Shelley, Karen and I have been communicating over Twitter. I actually found Karen on Twitter because I like to follow people who are experts in their field and actually can broaden my knowledge, right? And this woman, well, Karen is, she's really broadened my understanding of victim survivors of domestic violence. She's a psychiatrist and she is also a specialist in trauma and PTSD. And she's the founder of Doctors Against Violence Against Women. And I know that you're doing incredible work, Karen, so it's lovely to welcome Dr. Karen Williams.
Thank you.
Yes,
Karen,
welcome. So good to have you.
It's so lovely to have you. Now, Karen, there are so many layers to domestic violence and family violence and violence against women and their children. Of course, we start with hoping for prevention. So there's a lot of understanding around the cause that we need to learn. There's, of course, critical work in crisis response. But then there's the layer which is recovery, which is where you step in. And I know that you, as a psychiatrist, you're at the other end where you are, hopefully, you know, you're working with women who are victim survivors. Can you explain to us, as a psychiatrist, what is the impact of abusive relationships on victim survivors? How does it harm us as people?
Yeah, it's interesting that you know we have to ask this question, isn't it? Because we would assume that there's a broad understanding by now of what happens to people who are experiencing levels of violence that we know women are experiencing in their home, and yet there isn't really a clear understanding of that yet, which is really disappointing. And I think, you know, you think I'm a psychiatrist. Why am I seeing this stuff all the time? And it's not because people are sending women to me saying this person's experienced domestic violence and as symptoms as a consequence of that. Actually, what happens is they're sent to me with the diagnosis of things like depression or borderline personality disorder, bipolar disorder, substance use, that kind of thing. So they're not actually sent with the actual problem, but they're sent to me with all these other mental health conditions. So what we know is about 1/6 of Australian women will experience domestic violence. That's a huge amount of women. There's about 12 million women in Australia. And if 1/6 of them have experienced domestic violence, that's about 2 million women. And what we have learned from the research is that about 50% of those women, so about 1 million women, will be at some point diagnosed with a mental illness. And that will come after the relationship has started. So either during the relationship or after the relationship has started, not before, which kind of flies in the face of a lot of people who think it's crazy women that are in these relationships and there's something wrong with them and that's why they chose men like that or they stayed with men like that, right? You would have heard that kind of trope before. But actually the mental illnesses that you do see would come after those violent relationships. So I really want to make it clear that we still don't have a nice avenue for GPs or anybody to say, hey, listen, if you've experienced domestic violence, you probably need to go speak to someone who's expert in that and can give you some help around that, because we're not seeing it. We don't recognize that women are traumatized by those relationships at all. We don't see it at all. I think there are a couple of odd spots around, where there'd be a few people here and there that do recognize it. But people like myself who end up seeing it and working in that field, we're overwhelmed with work really, really quickly. It's not consistent, so it's not fair. It's not okay. It's not okay to go to one doctor who'll go, oh yeah, you must be experiencing PTSD, but then go to another doctor who has no idea and says, oh, you've got depression, you need an antidepressant for that, and not actually treat the core problem that's going on. So there's no real consistent understanding. But what we do see, or like what I would see, is exactly the same kind of thing that I would see when you see anybody that's traumatized by a violent act, or not even necessarily a violent act, but just similar to what a soldier might experience. The same symptoms, they're literally identical. They'll have Well, so it's, maybe it would help to kind of give you a picture of what happens to the person when they're traumatized. So
Hmm.
if you're experiencing a threat in your life, if there's somebody that's trying to hurt you or hurt your family, what happens to all human beings, because we're all animals, is we need to overcome that threat somehow, right? We either fight the threat, so get physically, we fight the threat, or we try to run away from it. But what happens in domestic violence situations and also in war is that you actually can't do either of those things. You can't um, really get rid of that threat, can you? You're sort of stuck living with it day in and day out. And that's the problem, is that when you are living day in and day out with somebody that's threatening your very existence or threatening your children, when you're on that constant alert, it means that your normal ability to turn off your um, threat response and turn it on starts to falter because it's on all the time. It's normal for me to say walk down the street if it's a dark night and I'm all by myself and I see a dark shadow. It would be normal for me to start having heart palpitations, breathing up, getting anxious, getting scared, right? But then as soon as I'm safe inside of my home, I should start to calm down. It's normal for me to have it turn on and turn off. But if you're living with a perpetrator, then when do you turn off? You actually never get that experience of turning off and turning on. So what happens is you're spending years living in that really hyper aroused state, that years of feeling like something is about to happen. And that's what it's like living with a perpetrator, because they're so unpredictable. One minute they'll be really lovely and warm and nice and affectionate. And then the next minute, they're angry and raging and then taking it out on you. So you don't ever want to really let your guard down if you're with somebody like that. So you're just on all the time. So even after you've left a relationship like that, you will be in a similar way, always switched on. So always anxious, always waiting for things to go wrong. What happens in these sort of relationships is you're always trying to predict what your abuser is going to do, what's going to make them angry, right? So you want to know everything about that person. So you get into their head and you try to understand what it is that makes them mad. So people who have been abused, they'll do that with everyone in their life. They're always sort of thinking, oh, anyone that talks to them in a funny way or in a different way, they'll say, oh, that person doesn't like me, that person's angry at me. They're always feeling like people are mad at them or about to get mad at them, and preempting that by just giving a hell of a lot. So they're very generous people that are always trying to keep everybody around them calm. They can't actually just relax and live their life for themselves, but they're very much about trying to look after other people. They don't really even know what they like. So a lot of women that are in those have come out of relationships like that can't tell you. They don't know what they like in their life or what makes them feel joyful. It's really hard when you ask the question, what do you like doing? They don't know, because they spent so long doing what their partner wants so that their partner stays happy and doesn't hurt them, that they actually haven't got an idea of the things that they like themselves. For example, if their partner is in a better mood when they eat Chinese takeout, right? I'm making it very simple, but let's just say it was something like that. Then when you ask her, what do you want for dinner? She's going to say, oh, Chinese takeout. Not because she likes the flavor, but because she knows that when he has it, he's in a better mood and he's not going to hurt her when he's in a better mood. So she sort of lives her entire existence of making sure that everyone around her is happy. And it's exhausting. They are exhausted people. They don't sleep a lot of the time. They're up all night, because who wants to sleep if there's a threatening person in your vicinity? I mean, you're sleeping under the same roof as a perpetrator. So they don't sleep in their relationships, and they don't sleep after the relationship. So they'll have problems with sleep. They'll have problems with enjoyment. They'll have problems identifying themselves, who they are, what they like. Like I said, they feel guilty about everything. They're the people that will say, oh, I'm sorry. For what? They won't have done anything wrong, but they're always that sense of guilt. They'll take the blame for everything. They have such low self-esteem that when people treat them badly, then they don't even recognize it, because they often see it as that's what they deserve and that's what's kind of normal. and somebody does something bad to them. So, well, if I hadn't done this particular behavior, then that wouldn't have happened. So it's that constant self-loathing and shame that they experience. And so when they go to the doctor and say, I'm crazy, I can't sleep, I'm depressed, a lot of the doctors won't ask them what happened to make you feel that way, but will say, oh, if you're not sleeping properly or you're not eating properly, okay, here's an antidepressant, try that. Or go for a run, that kind of thing. So it's that absolute invisibility that we have to the fact that there are huge amounts of women out there who are suffering from the traumatic impacts of things like domestic violence, but also things like sexual abuse. There's so much sexual abuse, so much child abuse. There's millions of people in this country that are traumatized and are invisible in our health system.
So, Dr. Karen, I'm hearing two things in there. I'm hearing from you that we actually need to train our doctors in a way that they are receiving the information and hearing the information and listening to their patients and being able to identify So I feel like there needs to be more work with our doctors in that area, is what I'm hearing from you. And also, when women are carrying this kind of trauma, what is available for them as treatment?
I want to also, be really clear that it's not any one group of people that has to be responsible for this, because it's not just the doctors either. Remembering that we are paid in a rebate system, right? So you get an amount of money paid back to you from the government if you want to bulk bill a person. So you want to remember most of these women won't be able to afford, to pay full costs. So you tend to rely on bulk billing. GPs have very minimal time to spend with patients in order to make ends meet, actually. They don't get rebated anywhere near enough. And they'll have a huge waiting room full of people. And they've got, say, 6 minutes to 15 minutes with each person. You can't just say, I want them to be better at asking about it. You actually have to create an infrastructure too, where they've got the time to do that, because it's not actually helpful or safe even to open up wounds like that with a person in a GP setting and then go, actually, run out of time. You've got your 6 minutes is up or your 10 minutes is up. But so it's not enough just to train them. It's also not enough to say, I'm going to train you up and I want you to identify PTSD. I want you to identify domestic violence or sexual abuse, but I'm not going to give you any services to refer these women to. So that brings me to that second part of the question, is where do you send these women? If you were a GP and you did identify that person was traumatized in some way, where would you send them? And I'll put the question back to you. Where do you think you would send them? Where would where would a GP send a person who they say, okay, this person's been really abused, they are very traumatized, they're suffering a lot, they're suicidal. What do you think? Where would you think they should go?
Well, I guess before I spoke with you, Karen, I would have assumed that there was somewhere similar to if I was someone who'd been in the Defence Force, if I was someone who'd been in the police force, I would assume that there was some kind of service that a GP could refer me to. But I know, having spoken to you, that is not the case.
Yeah, so if you were suicidal, if you just wanted to die because of what had happened, you weren't able to feel any joy, you felt like constantly your life, you were on edge, and your suicidality is a huge symptom that they'll have, and self-harming. The options are to go to the public health hospital, like you go into, the public hospital and you speak to a doctor and they ask you, are you suicidal? And you say yes. And then you get put on the acute psychiatric unit where you are in a locked ward. You will be with men as well as women. A lot of the men will be disturbed, as will some of the women. There'll be lots of noise sometimes and screaming and sometimes aggression. And there will be no one that will really address your trauma at all. There's no sort of set PTSD program within the public health system at all. There isn't any such place where you could send a person who had PTSD and get comprehensive care and guarantee that the person is going to get a psychologist that really understands trauma, or a doctor that understands trauma, or would even identify how to treat PTSD properly. So there isn't such a place. That is the answer, that there isn't any place in Australia where you could go, I'm going to send you there. And also, I mean, there are some places where you could get care if you had private health insurance, you had money, you may be able to get care in that setting, but not the average woman who has experienced family violence or sexual violence and doesn't have access to money.
I want to just
So,
acknowledge...
Dr. Karen, you've actually been lobbying for a trauma centre for women. Tell us about what you've been doing in this space to basically solve the problem about what you've just been telling us about.
So I ideally would like to see every woman in Australia be able to access the same kind of care that any veteran would have, any first responder, any police officer. I would like to see them have a place that's safe for them where they can have trauma-focused therapy, every woman. But because there isn't such a place yet where they can have all of that, I've joined sort of forces with a wonderful group of women who are from the Illawarra Women's Health Centre down near where I practice, and we've got a pilot program that we've designed where we have a one-stop shop for women to go to. It will be called the Women's Trauma Recovery Centre, where women who have experienced PTSD and domestic violence or sexual violence at any point in their life. It doesn't have to be a crisis thing. It doesn't have to be in the middle of them experiencing violence, or it doesn't have to be a month later or 1 year later. It can be 10 years or 20 years later, where you can go and receive the treatment that you deserve and need for PTSD that might arise as a consequence of violence. And it would be a place that's only for women, because most of the women who I've worked with or my patients are quite traumatized by being in the vicinity of men, and they are actually more distressed by that. So it would be a gender-specific place. Yeah.
I want to acknowledge, actually, Karen, we've had some comments on Facebook. One of our followers has said that she was put on antidepressants during her traumatic relationship, and she stayed on them for 28 years, and she's only just weaned off them last year, and now has been told her brain has trauma from taking antidepressants for so long, but she was given no option except to take medication, which is just that systemic misunderstanding of what she was going through. And so I guess, hopefully, Karen, this kind of conversation, if we're having it more and more, there'll be a greater understanding that, of course, there are millions of women that we're working with every day, that we're standing next to at school pickup every day, who are carrying considerable symptoms that we need to understand better.
Yeah, and listen, I mean, again, going back to it shouldn't just be one group of people like doctors that need to improve their understanding, right? Because women that are leaving these violent relationships, they will almost always have children. And a lot of those women are going to have to go through the family law court to try and get orders around the safety of their children. So we have this funny little world that says, you know, women, if you're in these violent relationships, you should leave, right? We tell them you've got to get out of there. But when they try to actually leave, we go, actually, no, you can't do that unless you're going to make sure you keep seeing your perpetrator and you keep allowing your children to see the person that has been assaulting you, right? That's what we say to them. You have to facilitate those relationships. And so women are forced into the family law court. And in that family law court, if they've got any kind of mental health issues, that will be used against her, because he's very likely to throw in her face and put forward to the court that she's crazy. It's what they do all the time. We see it all of the time. So if you've gone to a doctor and they've given you the wrong diagnosis and said that you're depressed, or even if you are saying, I am depressed, I am anxious, I'm scared, and rightfully you should be if you're living with an abusive person. But if you have that history, then that's going to get used against you in the family law court. And they will say, well, is she really a good mum? And maybe she would be better with him, who's very stable and there's no just overt displays of mental illness in his life. So they would give, again, a weight to that mental condition as if it were going to make her parenting bad in some sort of way. So if we don't have the court systems and the police system understand what this looks like as well, then that's not it. Then again, we're going to keep letting women down, aren't we? Because that is what we see. I see it all the time, where women are losing custody of their children because of the fact that they've got histories of maybe substance use or any of the things that the person might use to manage being traumatized. So seeing a psychologist, seeing a counsellor. Yeah, and then the other thing to think about is... Oh, sorry.
No,
go,
Michael,
go,
keep going.
I
was going to say, there are also the things that... You go.
Well, I was going to talk about the fact that child protection is another issue too. So if we don't allow women to leave these relationships easily, right? We don't have places for them to go. We don't have safe accommodation. We don't have, we don't even often let them have AVOs because we say, well, he's saying he didn't do it, and you're saying, so it's his word against your word, and we don't have treatment for you. But if you do get treatment, we're going to use that against you. So when a woman has tried to get out of those relationships and has been unsuccessful, or if she hasn't even tried because she knows that she's not going to get anywhere because she doesn't have evidence, and that happens all the time, then child protection can step in and say, well, you haven't really done enough to protect your family, and we're going to take your children off you as well. Because they don't understand PTSD, they don't understand coercive control, they don't understand how the court systems do not protect women, and they will then traumatize the woman further by saying, if we keep getting reports of police turning up at your place, then we're going to take your kids off you. So then women go, I don't want to call the police, because if I call them, then that will get reported to child protection, and then I'll get my children taken off me again. So it's more than a double bind. It's the whole society is tying the hands and feet of women who are trying to escape these relationships.
Well, Karen, I want to reflect what another one of our followers on Facebook today has said. Karen, you're on point and wise. Thank you for the work you are doing. This is such a complicated conversation, and there is no happy ending at this stage. There is absolutely no way to wrap this up in a way that feels positive or optimistic in a lot of ways, other than to say that now that we are alert to the fact that you're working towards a trauma centre for women, we stand behind you and with you, and we'll try and keep this conversation going as often and as loudly as possible, because it's absolutely critical. So, Karen, thank you so much.
Yeah, that's the thing. Can I just say one more thing about that? Because with women that have been traumatised, they don't feel deserving at all. You have all of these millions of women who think it's all their fault, and they shouldn't have been in relationships like that to begin with. They're the ones that have stayed in them for too long. They're depressed, they're anxious, they hate themselves. That's really what I'm seeing all the time. So they're not going to be standing up and screaming out for this stuff. They're not going to say, hey, why isn't there PTSD care for me? Why isn't there care for my child that's experienced all this violence in their life and witnessed me getting bashed? Why isn't there more available? So it is up to the rest of us that can stand up and to rally those women to be able to raise their voices and say, this is what happened to me in my home, and why haven't I been able to access these things? Because we are very powerful. We are 50% of the population. We are 50% of the voting population. So if we can raise the voices of everyone around us as well, it's not just you guys, but that we start demanding that from our government.
Absolutely, we are powerful. Thank you so much, Dr. Karen Williams.
Thank you.
No worries.